Welcome back to Midday. Monson Family Dentistry is a family-oriented practice with a focus on oral health and education. Dr. David Monson is here to tell us more. Welcome to the show, Dr. Monson.
Thank you. Thank you for having me.
Well, let's talk about, first of all, general dentistry. What exactly does that mean?
So pretty much we're allowed to do a large array of everything.
Okay.
So particularly in my practice, I don't really refer out a lot of patients because I'm able to do anything that I'm wanting to do.
Gotcha.
So pretty much when you come to my office, you stick with me.
Yeah.
For most of the cases. Some things are a little more complicated. I might send you out to someone else. But routine root canals. I can place implants, crowns, stuff like that.
But why is that important to a patient when they come in?
Well, usually you build a rapport with the patient, and once they kind of come in and they feel comfortable with you, and then all of a sudden you come up and you're like, well, you need this tooth extracted, I'm going to have to send you somewhere else.
Right.
They usually get a little more anxious about that,
right.
and they really don't want to do that. So, so when they say, yeah, we can get that out today for you, not a big deal, or we can do that filling, we can do that root canal right now, it just puts the patient at ease.
Right, absolutely.
You said something about making sure the patients are comfortable. How do you approach the scared ones that don't want the dentist work and people are afraid of the dentist?
Communication.
Communication.
Just talking to them, and just showing them that everyone always gets this misconception that everything is horrible from a really bad experience. And,
yes.
And usually just talking to them, kind of walking them through how the procedure is done. It usually puts a lot of people at ease.
Awesome. And what kind of procedures do you do in your office? You had mentioned you do just about everything. What are some examples of
So most time when you think about going to the dentist, filling a cavity.
Right.
So sometimes if the cavity gets too big, you got to do a root canal if you want to hold on to the tooth. So that's something that I like to do in my office. If the tooth is unsalvageable, it needs to be extracted, I can do that. And then you need to look at replacing the tooth, so like an implant.
Okay.
That's something that I can place at the office as well, instead of having to go see 2 or 3 other doctors in order to get that procedure done.
That's really good that you do all of that in your office, because it is scary. I mean, you're already kind of freaked out if you have to get an extraction done, let's say.
Exactly.
I mean, you're already scared to death as a patient. So to have to be referred out for something like that would be horrifying, I would think.
And meeting someone else, and which there's definitely a lot of good doctors out there that I refer to, and I trust them fully. But it just seems like patients just enjoy staying with one doctor and working on it.
So do you need dental insurance to come to the dentist?
You actually don't, and I get a lot of patients that they don't come in for years and years and years, and they're like, well, I didn't have dental insurance, and it can usually get actually more expensive if you don't come and see a dentist on a regular basis.
Right. So you should come whether you have insurance or not, because if you let things go, it gets worse and worse.
Right. And even if you don't have insurance, we work with you.
Yeah.
It's not something that dental is sometimes expensive. But,
right.
But we work with patients on an individual basis and help them out as much as possible.
Now, I know the hot trend is teeth whitening. Real quick, what's your recommendation with the tooth whitening?
So right now we got a good procedure. It's called Zoom whitening. So it's pretty much an in-office procedure.
Yep.
You get up to 4 sessions, 15-minute sessions at one appointment, and a lot of people are able to jump from kind of a yellowish shade to a bright white all within about an hour.
Yeah, and you know what? I had this procedure done. I had the teeth whitening, and you told me that there was going to be little zingers, what the side effects were going to be of this, and it went exactly the way you said it was going to. But you said that they would go away, and they went away by the next day. They were
again. That's
part
part of the education. Let people know what they're going to expect prior to doing it. So then when something happens,
I was just going to ask, how much is their procedure?
It's usually somewhere between $400 or $500, something like that.
Okay,
yeah.
I'll be there in about 2022. Let me get
we will work with you.
We will work, and I'll be there.
His teeth look really white.
They do look very white.
I know, right? But thank you so much for being with us today.
Pleasure.
We really appreciate it. We have all of your information up on the screen. Stay tuned for more Midday coming up after the break.